Okay, guys, we are discussing about the pathophysiological factors in respiratory failure. Okay, so in that last video we discussed about the airway resistance and lung compliance. Today we are going to talk about the hyperventilation and these all. Okay, we can mismatch and intrapulmonary shunting and diffusion effect. These four topics we are going to cover. Okay, first of all, hypoventilation. So what are all the causes that lead to the hypoventilation? Okay, first CNS depression. This means the central nervous system is not working normally, and any neuromuscular diseases. It also leads to hypoventilation and airway obstruction. It also leads to hypoventilation. Then it is characterized by, which means hypoventilation can lead to the decreased alveolar ventilation and also decreased arterial CO2 tension. Yeah, in arteries there is a increased CO2 tension. Okay, so in alveolar there is a decreased ventilation, and also in artery CO2 tension is higher. That is called hypoventilation. Okay, I talk about the alveolar ventilation. Okay, so what is alveolar ventilation? We should know about the alveolar volume. Okay, so volume of the tidal volume that takes part in the gas exchange. Okay, so VA is equal to Vt minus Vd. Okay, that is in tidal volume. Amount of volume is takes place in the gas exchange, that is called the arterial volume. Okay, so alveolar volume is directly proportional to the tidal volume and inversely proportional to the dead space volume. That's why it comes under the minus. Okay, tidal volume minus dead space volume is equal to alveolar volume. Okay, this is all about the hypoventilation. Hypoventilation means only two things: alveolar ventilation is reduced as well as arterial CO2 tension is increased. That's it. Okay, then come to the next topic, that is VQ mismatch. Okay, let's come to the VQ mismatch. So what is V bar Q? It is a ratio between the amount of ventilation and amount of perfusion. So that is the VQ. Okay, so VQ ratio is in lower lung zone 0.4, in upper lung zone 0.3. so it is because of gravity. Okay, so in lower side there is a more perfusion is there, more ventilation is the perfusion ratio. Okay, so the VQ mismatch lead to hypoxia. Okay, which means some parts maybe get ventilated but there is no perfusion, which means no oxygenation is there. So that is the hypoxia. Okay, so it can be corrected by the rate of respiration and the tidal volume and the oxygen, that is and the process of the exposure to the ventilation. So by this we can reduce the hypoxia. So this is all about the VQ mismatch, that is the uh, ventilation is not matching with the perfusion. So the ratio between these two is not matching, then it is a problem. It also lead to the respiratory failure. Okay, then come to the intrapulmonary shunting. So intrapulmonary shunting, it is a perfusion is occurs only if the ventilation is excess, which means if the ventilation is more high, then only the perfusion occurs. Okay, so this is the shunting. Okay, intrapulmonary shunting. So it lead to hypoxemia. Okay, and also the lung, that is intrapulmonary, is not responding to the O2 therapy. So even we are ventilating, so the more ventilation needs to achieve the perfusion. Okay, for normal patient, for normal persons, physiological shunt is there, anatomical shunt is there. Okay, so on that shunt, more than less than 5% of the processes happen like this. Okay, so even we having the O2, there is no perfusion takes place. Okay, it is normal thing. Okay, but in patient, okay, critical patient, non-critical patient, the percentage is increased to 10%, 30%, like that it will increase. Okay, so more than 30% is also having. So in heart we may talk about the shunt. Okay, what is shunt? There is a mixture of the oxygenated and deoxygenated blood is happening inside the heart. Okay, or any artery, any vein, there is a mixing is happen. Then it is called a shunt. Okay, so the mixing is happen. That's why more oxygen is needed for getting the perfusion. Okay, so even the blood has the oxygen, so it does not. It is mixing again. Okay, so that is why the cells can't take the oxygen. So the perfusion is reduced here. Okay, so the okay, so it right to left shunt is a perfect example for the VQ mismatch. Okay, so there is a ventilation is more, but there is no perfusion is there because of shunting process, because of mixture of oxygenated and deoxygenated blood is occurring inside the pulmonary and so is cardiac region. So it lead to there is no perfusion happening in the tissues. Okay, so not only right to left shunt, there is in atelectasis, atelectasis, ARDS, and lobar pneumonia, and pulmonary thromboembolism, uh, cardiogenic pulmonary edema, cardiogenic pulmonary edema, and pulmonary arteriovenous malformations. In these all, there is a VQ mismatch. Okay, that is a ventilation and a perfusion mismatch. That is also comes under the leads to the intrapulmonary shunting. For shunting, there is a equation is there, that is USP by QT is equal to CCO2 minus CaO2 by CCO2 minus CvO2, like that formula is there. Okay, so this is all about the shunting equation. Okay, it is called the shunting equation. Okay, next we are going to talk about, I don't want to talk deeply about it. Next we are going to the another factor. Okay, that is a diffusion defect. Okay, we talk about the intrapulmonary shunting and diffusion defect. This is the last one. Okay, when the process of diffusion happens, when the oxygen is come to the lung, then diffusion happens. Then only the alveolar blood inside the alveoli there is a blood. Okay, so that blood is going to get the O2, so that it is in the process of the diffusion. Okay, so if there is any diffusion, if example take a tachycardia, in tachycardia heart rate is high, so the blood is come fast, so on the time the diffusion does not happen. So insufficient time of diffusion is happening in the tachycardia, and there is something called a gradient. Okay, that is a alveolar and a arterial gradient. So A to A, like that is they call. So that is the oxygen level in the alveoli as well as the oxygen level in the arterial blood, that is a partial oxygen in the alveoli and artery. So small a refers to the artery. So these like gradient is there. So there should be a diffusion happening between these two. Okay, then only the normal transferring of the oxygen is happen. So if there is any problem, diffusion defect, then it also lead to the problem in these. Okay, and also A to C, that is alveolar capillary membrane. Okay, so there is also the diffusion occurs. Okay, so alveolar to capillary. Okay, which means the capillary lead to not only the artery. Okay, but also CO2 is comes towards the alveoli. Okay, then only the CO2 getting removed. That is why the C term is referred here. That is the alveoli to capillary uh, gradient. Okay, capillary membrane gradient. The problem in diffusion occurs in many more area, like high altitude region, fire combustion, and pulmonary edema, and retained any secretion is there, then it also leads to the that diffusion defect, and pulmonary fibrosis, and tachycardia. So in this all the diffusion defect is occurring. And also we have the oxygenation failure. Okay, oxygenation failure. So it is due to the reduced O2 in organ and tissue. Okay, even the partial pressure of oxygen is normal. Okay, so it is known as oxygenation failure. Okay, so it has a four type: hypoxic hypoxia, histotoxic hypoxia, stagnant hypoxia, and anemic hypoxia. These 4 types are there in the oxygenation failure. Okay, so the person who having any of these needs the ventilation. Okay, so even when the person getting the ventilation, it is not enough. Okay, the perfusion is needed, the oxygenation to the tissues is needed, and the diffusion should be happen normally. So like this, we have to see these all. Okay, it also leads to the respiratory failure. Okay, so these are all the things we have to notice in the mechanical ventilation. Okay guys, thanks for watching. In our next videos we are going to talk about more and more topics. Thanks for watching. Bye bye.